Can you reverse post-finasteride syndrome? Okay, in this video, I will tell you my insights from seeing probably 1000 blood tests, okay, of PFS, PSSD guys, okay, and I will tell you why most treatments fail, okay. So let's start with common knowledge about post-finasteride syndrome. The common knowledge is that DHT is affected via 5-alpha reductase enzyme, so there is some kind of deficiency, okay, or some kind of blockage of 5-alpha reductase functioning, okay. This is the most common thing, but why I have such a good success rate with clients is that I look at the whole body, okay, and I will explain why most of the treatments are not helping at all, okay, because the thing is that most of these coaches, doctors, they will focus on things like testosterone, okay, so increasing hormones, okay, but from my point of view, it's not a solution because honestly, if there are other things in the system, okay, let me start with this, okay, so you took finasteride or anything similar, okay, because there was some problem, okay, and hair loss is mostly connected to metabolic issues, okay, and nutritional deficiencies, okay, and because some of your hormones are off, okay, it's not about like DHT. I have super high DHT, okay. Honestly, I never seen really PFS PSSD guy who had really super high DHT. Never ever, okay. So I have normal clients, okay, with like DHT 150 200, and they still got hair, okay. So explain me this, okay. So it's not about genetic, okay. So because yeah, there are many clients coming to me, yeah, it's genetic thing, my whole family has genetic problem with this, and I'm still one who still keeping the hair, okay. So why is it so? Yeah, so you need to understand, of course, genetic predisposition will give you worse startup position, but you can manage this, okay. I got one guy, for example, recently, you know, who is restoring the hair, okay, because he started to look not at the DHT but all the other things happening on his scalp, because all this happening is locally, okay. So what is the reason to nuke DHT in your system when all of this is happen locally, okay. So you really need to understand, yeah. And like I said, the main reason why you took finasteride, dutasteride, is that something metabolically was off, okay, or some hormones, okay. We are talking about things like estradiol, you know, gut serotonin, we are talking about prolactin, low IGF-1, okay, and you took finasteride and you help with that, okay. So but I think finasteride can also like magnify the metabolic issues, okay. So it's not like somehow it magically block all the enzymes and so on, okay, but it's like last hit to your problems, okay. So let's take a look what's going on, okay, when I research the guys with PFS PSSD, okay. So one guy was talking about, you know, genetic predisposition, okay. When I look at the thyroids, complete mess, yeah. So you need to understand that if your hairs are thinning, okay, you need to take a look at your thyroids, okay. So, and this guy, even his DHT was pretty low, okay. He tried to convince me that this is because of the DHT and so on, okay. His hormones were not good at all, you know. So, and on top of that, thyroids are very bad, okay. So that's the first thing, okay. Another client of mine, yeah, extremely high TSH, yeah, young guy, extremely high TSH, okay? So, of course, if you have issues like this, your hair will thin, okay? Your hair will be thinning, okay? So, even as I getting older, you know, so sometimes I'm not, uh, sometimes I do not follow all the guides I also give you guys, and I see that, for example, I start to shed hair and so on. Then I take a look at my thyroids and I see, for example, okay, TSH increased, okay, but still my TSH is much better than most of you, okay. So you really need to understand that you need to take a look at other things, okay. So also for fixing post-finasteride syndrome, okay, so the thing is you need to look at your T3, okay. T3 is a big activator of 5-alpha reductase enzyme. I mentioned this in different videos, okay. So another thing I see quite a lot and I talk a lot, guys, check this, okay. Methylation, okay, methylation. So many guys are under methylator, okay. So of course do the test, okay. Don't assume you are under methylator or over methylator, okay. Do the proper test, okay. If you need my help, you will find a link for my coaching under this video, okay. So guy, I see these my last 5 clients the same thing, okay, the same thing again and again and again, okay. In last 5 cases the problem was folate, okay. You need to understand dopamine, blood flow, all these kind of things. Folate is the king, okay. So even homocysteine, okay. Many people think that folate is some, you know, methylation supplement, okay. So not, it's not, okay. So folate you need even for DNA damage and so on. So extremely important, okay. So if you think you will increase folate but supplementing folate, you are a little bit you're a little bit off, because it's most likely not going to happen, okay. You need to look at this more in details, okay. So you need to have specific test that will give you the reason why your folate is either low or not used by your body, okay. Another things I see quite a lot, guys, it's folate trap, okay. So you have enough of folate, yeah, but you cannot use the folate, okay. Again, dopamine, blood flow, okay, erectile quality, yeah, all this kind of DNA damage, methylation, okay, can also have effect on your 5-alpha reductase enzyme, on uh, DNA expression, okay. So you need to be aware of these things, okay. So you really need to do like proper testing for methylation, homocysteine, B12, active B12, folate, and based on all of these there is a fix, okay. So uh, fix is a little bit more complicated, depends on the blood test, but it's not, like I said, only folate. And most of you guys, if you try to use things like methylfolate, you will mostly run into the more troubles like flat mood, you know, so a lot of anxiety and so on. Also, you need to understand that, for example, like dopamine issue and so on, many guys just watch the video about B6, they start to supplement with just B6 and they run into many troubles, they prolactin rebound and so on, because there are codependencies, okay. So uh, I am big fan of B vitamins, especially even for things like post-finasteride and PSSD, but first of all you need to have active forms and specific forms for your case, okay. So stay away from the things like folic acid, okay. In most cases you don't even need to supplement with methylfolate, because like I said, it can you know recover other things, okay. So okay, so we've been talking about, you know, folate trap, methylation. Okay, so this is why you cannot recover. Okay, so another thing. Okay, iron. Okay, so very low iron. Okay, so you need to understand your head, for example, need iron. Okay, if your level is low, you will lose your hair. Okay, that was my client. Okay, this client was combination of low iron and very low folate. Okay, so on top of that, high CRP, yeah. On top of that, intracellular B12 was low, you know. So also you need to understand that even for dopamine, okay, BH4, yeah. Of course, we need to have a folate for that. Okay, so many guys are also deficient in B2. Okay, so B2 is extremely helpful, but the problem is most of you guys, even if you supplement, you will not get active B2. Okay, because there are many cofactors. Okay, even proper function of your thyroids affect transition of B2 into active B2. Okay, so B2 is another magical thing that can help with recovery. Okay, but you really need to know how to, you know, put all the things together. Okay, so what I also see, high homocysteine. Okay, it's connected with methylation. I think it was like 30 years old guy with homocysteine around 20. Okay, 20 guys. Okay, it's very high. It's causing vascular damage. Okay, vascular damage. It has effect on erection and so on. Guys, yes, DHT helps with smooth muscle. It's anti-fibrotic. Okay, it increase enos, but you have also other ways. Okay, so it's not like yeah, I boost DHT and suddenly everything will work. Okay, so I know guys that have even proper DHT levels. Okay, this is another thing. Okay, proper DHT level, but you will do the Dutch test and you will see you go more likely 5 beta pathways. Okay, this is another thing. Okay, but I think only Dutch test can show you this. Okay, that you go 5 beta. Okay, and really important thing. Okay, so even for prolactin, elevated prolactin, and so gut health. Okay, so I did last summer, I did, you know, like test for myself and for one of my client. Okay, uh, I struggle recently with some gut issue, so maybe I already mentioned in other videos gluten sensitivity and so on. Okay, and if you have gut issue, you can have elevated IL-6. Okay, and IL-6 will block 5-alpha reductase enzyme. Okay, and for example, last year in summer, I did this for me and for one of my client. It was just gut fix. Okay, and in my case, just in 1 month, okay, my DHT increased by almost 50% in just 1 month. Okay, the 5-alpha reductase functioning was not blocked. Okay, but it was much lower as it should be. Okay, but just in 1 month, okay, in 1 month I was able to, you know, add more than 40%. Okay, so in 1 month, in 2 months, I almost doubled. Okay, my DHT just by the gut fix. Okay, so there are also other things that cause elevated IL-6. Okay, so I see also in younger guys or very young guys that, for example, they have some kind of gut issue and even they have proper testosterone, their DHT is not that good. Okay, and we need DHT. You all know, yeah. So DHT is also nootropic. Okay, so I'm not big fan of like nootropic supplementation, especially if you don't know what to do, but DHT is really a nootropic. Okay, so guys, do proper test. Okay, if you can, IL-6, you know, homocysteine, nutritional deficiencies, okay. One big thing I see in few guys also is mitochondrial dysfunction, okay. So low coenzyme Q10 and all other things contributing to like low androgens, okay, because you can take TRT, okay, but you really need to understand why your androgens are low. And the biggest reason is that your ATP is not on point, okay, your energy is low. Your steroidogenesis depends on your energy level. If you don't have proper energy levels, it will stop, okay. So for example, another thing, if your testosterone is good but your DHT levels is low, you need to take a look at NADPH, okay. I also talk about this in many videos. So guys, that's it. So it's not only DHT problem, it's like I said, you need to take a look at things like methylation, nutritional deficiency, okay, your thyroids, your iron levels, and then you will fix this and you will fix also your issues. You have better erection, you have better dopamine, and you feeling much better, okay. I forget to also mention the vitamin D levels. Many guys, PFS guys, PSSD guys have very low vitamin D levels. It's also helping with, for example, serotonin in your gut, okay, so you don't have this over amount of serotonin in your gut, immunity, and many other issues, okay. So if you need my help, you know where to find me, and let me know what you think.